Thank you. I believe that there was an individual who would like to respond to Senator Mitchell's comment or question of Dr. Bob Sears, which I believe Senator Mitchell said that he could answer the question.
If I may restate the question, because I see people don't have a copy of the bill, it's being passed around. I'd like you to show me in the bill, the February 19th, 2015 version that we are voting on today, the language that corroborates what we've heard in public testimony all afternoon now, that suggests that a child who for medical reasons should not receive an immunization will now, if this bill passes and becomes law, will be forced to. Show me the language.
Thank you for asking, and thank you for giving me the opportunity to step in. I'm a full-time practicing pediatrician every single day, so I do this every day. I will concede that the language in the bill does allow parents to seek a medical exemption and get one from a doctor. I will agree with you that the language is there. In practical terms, it'll be very difficult for parents to get a medical exemption. I meet patients every day. Yeah, every day, I almost every single day in the office, I see a new patient who had a bad vaccine reaction, maybe a whole week of high fevers, extreme irritability, lethargy, didn't take the vaccines well, but their doctor didn't take it seriously enough, and their doctor won't give them a medical exemption from subsequent vaccines, so they come to me for a second opinion. But I'm just one doctor. So I think there'll be many, many families out there that will find it extremely difficult to have a doctor agree with them that their reaction was bad enough to warrant a medical exemption. And I think in practical terms, parents will sort of feel forced to continue to immunize.
Is there any language in the bill that would penalize a doctor for granting an exemption?
No, not that I know of, but I think in practical terms, many
based on your experience in your practice?
Yes, yes.
And correct me if I'm wrong, please, Mr. Chair, or the author, the organization that represents, well, I know CMA is supportive and they represent pediatricians. Any of the other organizations, the American Association of Pediatrics is?
The American CAP Pediatrics is the official organization representing pediatricians.
And they are in? Support of the bill. Thank you very much for stepping up and attempting to answer. And honestly, I appreciate that, since there's nothing in the bill that says that. Thank you.
I believe Senator Wolk had a comment, is that correct?
Yes.
Okay, and then we're going to go back to, go ahead, I'm sorry.
Thank you, Mr. Chair, and I don't have any questions, but I do want to make some comments before we move to a vote. First of all, I am the mother of 2 and a grandmother of 6. And for those of you that spoke that had, who either lost children or had children that you believe were harmed, for whether I agree with you or disagree with you about how, my heart really does go out to you. It is awful to be a parent and have a child that is harmed or hurt, let alone lost. As a grandmother, I can tell you, as I watch my sons and my daughters-in-law, I think it's tough to raise children today, really tough, tougher than it was for us. There's a lot to worry about that we never worried about. What's in the food, what's in the milk, the additives, the chemicals. I mean, there really is a tremendous amount of anxiety out there by parents. Your generation has a tough job. I'm worrying about heading soccer balls and playing football and all sorts of things. And I just, you know, my heart goes out to you. I'm 68. I was born in 1946. And I remember these diseases, having had measles and chickenpox, and friends who had polio. The polio vaccine didn't come in until I was probably in, I don't know, 10, 11. How fearful it was for us as children to swim in the summer because we might have gotten a chill, we might contract polio, and thereby end up in one of these iron lung machines. And we all knew people and kids that happened to, and adults. I lost a very good friend in college to mumps I mean, mumps, 18-year-old, healthy otherwise, just lost. So I am a strong proponent of vaccinations. And, you know, I think, just I'll conclude by saying, I think we do have our individual rights aren't limitless. They aren't without limits. There is no such thing as an absolute individual right for anything that I can think of. And in this particular case, your insistence on your right really could harm my children or my grandchildren, and a lot of other people who, through no fault of their own, are either babies, immunosuppressed, having treatment for terrible diseases. I really can't support. I am in strong support of this bill.
Senator Roth?
I just want to make sure I'm clear on the medical exemption. And in looking at the bill language, it provides for, quote, exemptions from immunization for medical reasons. And that's the language. So who determines what a medical reason is? Is there a standard that is commonly accepted? Is there a requirement that the CDC puts out? Is there a rule that physicians and other healthcare providers are required to follow, whether it's a CMA rule or a Pediatricians Association rule, or is it simply left to the discretion of the individual healthcare provider whether the vaccination is medically appropriate or not? Dr. Pan?
So there is a definition in statute. It's obviously, we did not touch that in the bill, which is why you don't see in the bill language. But it basically says that a licensed physician in the state of California, in their professional judgment, can grant the medical exception. So there's no restriction in terms of guidelines or other types of things other than their own professional judgment. Certainly, we expect licensed physicians to exercise, and other licensed health professionals to exercise professional judgment and not to do that willy-nilly because we want to be sure we protect. But if you think that there's a risk, if I see a child, I'm a pediatrician, if I see a child and I think that there is there's something about the child that's going to put, that vaccine is going to put that child in danger, then I would give them a medical exemption because I would not want harm to happen to that child from a vaccination that I gave them.
Do the limitations on liability associated with the use of vaccines negate any malpractice actions against physicians for administering vaccines under those circumstances?
In terms of granting the exemption?
Or not granting the exemption?
Or not granting exemption?
And administering the vaccine. I'm just trying to figure out what the risk issue is for the healthcare provider.
Well, I'm not aware. I have to admit, I haven't sought a professional legal opinion on that. I can certainly, I don't know whether you have more of a thought on that. I'm not aware of a risk. But it is this bill is going to judiciary, so we can clarify
Well, I don't
this issue
sit
then.
on judiciary,
Right.
so I get to ask my questions here.
But there's, I mean, it is at the professional judgment of the physician. So if a physician is acting in a way that's unprofessional in making their decisions, they could be, I guess, assumed liable or be at risk for the medical board. But if they can demonstrate that they use due care and exercise appropriate medical judgment, and then the physician would, basically the law says the physician's free to do so.
But I just wanted to add that we heard from Dr. Sears, and he's an example of someone that some folks go to for a second opinion. This happens all the time in medical proceedings. Someone may not like the advice given to them by their doctor. They go to someone else, and sometimes that doctor may agree with their assessment. And so, he's an example of someone who folks can go to for a second opinion and provide that medical exemption if they're dissatisfied with their first doctor's advice.
Got it. Well, thank you for the clarification. Thank you, Mr. Chair.
I believe, did Senator Nielsen have a comment, question?
Well, it's, Mr. Chairman, a comment and observation. First, I'd like to say that this is a very strong issue with passionate feelings. And I compliment the audience for their restraint today. I've been a part of a lot more hearings over these many years that was much more expressive than this one. a couple did cross the line, and I wish that they would take that as a lesson. That's not okay, and it's not helpful to whatever they believe in. This is one that we agonize on, and it's, for we legislators, it's where we earn our pay. And you have to deal with many issues that you're weighing. To me, it always comes down to what's in my heart. And in this particular case, I have very profound feelings about parental rights and responsibilities. And great dismay in American society over the decades how much that parental right, that parental responsibility has diminished, in no small measure by parents themselves, but also enhanced by actions of our government. And that's where I come down on this one. When I finally have to weigh everything, I found the doctor's response compelling about how hard it might be for a doctor to say, well, yeah, you can have the exemption. And I think that's compelling, and that does limit the parental responsibility and authority a bit. And the option of going to homeschool will be availed to many, but a lot could not do that for a whole lot of reasons. So my heart comes down on the side of what I call the parent's responsibility for their own child. And in my heart, no, please don't do that. In my heart, I'll be a no vote. But I certainly respect the strongly held opinions of everybody else. And wherever we go with this, we do have to weigh the cumulative public health aspects. I'm convinced we can still accomplish that, maintaining parental authority and responsibility, and therefore will be a no vote.
Senator Nguyen, comment?
Yeah, thank you, Mr. Chairman. I want to first thank everybody for being here today, having the patience to be with us. It's been a very long meeting, and you've been here and you've taken your time out today on both sides, whichever side you're on. For myself, you know, I have the utmost respect for parents' rights. For those who don't know, I have two children, a 4-year-old and a 2-year-old. I never knew how tough it is to have children and how hard it is to have to make these choices. The choices I've made, my parental right, is to vaccinate my children. And prior to even having my children, I've actually worked very hard in my county supervisor district, which is the poorest district in the county of Orange, to get vaccinated. We're well over 80% of our children in the school over there, which is 60% of my Senate district, are vaccinated. And, you know, I believe in it because I think that, you know, you have your rights, I have mine as well. And we're talking about, you know, this is a public school. I want to be able to have my children to go public schools. I'll tell you, my two children are in preschool, and I never knew what hand, foot, mouth disease are until you put them in those schools. I got it because they got it, you know, every week. And this is not a public school. It's actually, you know, a Boys and Girls Club preschool that we pay for. You know, every now and then I see, I think, if I recall correctly, there was one that was a few weeks ago or a month or two ago. We got, you know, when we go in and sign our children for the day, it's, you know, your child might be exposed to measles. And my children has been vaccinated from the day they were born till actually a week ago. I took the 2-year-old and the 4-year-old to get the 2-year-old vaccination and the 4-year-old vaccination up to date. And so, you know, this is a very difficult decision because on both sides it is extremely emotional and it is very personal on both sides. And so, you know, please know that I have the utmost respect for your decision, what you want to do. And, you know, that's why with this section from the author's amendment on homeschooling was a very important issue for me, because there are children who are homeschooled in my district and in Orange County as well, that, you know, I look at it, if you're homeschooled, you're not going to the public system, which we are paying and bearing the cost from the state. And so, you know, I look at this, you know, as the public institution itself. if my children are vaccinated, but then ends up with the disease because you have the right to make that decision, you know, it's much more difficult, and I think it's not the right choice. But you know, so this is not an easy decision at all from my end. But I do look at my 4-year-old and the 2-year-old that when they get the shots, how difficult and how hard it is. I'll tell you, the 4-year-old took the shot this last time around, ran out of the room, ran up and down the hallway screaming at me. And being a mom, it was very difficult to watch that because it did hurt him, obviously. And also, actually, no, I'm sorry, the 2-year-old did not get any shots this time. The 4-year-old did.
4-year-old did, yeah.
But, you know, so I will be supporting the measure.